All right, well, let's go ahead and get started. To everyone who's already joined us, I'm Cynthia LaBella, and I'm the chair for the Practice and Policy Committee at AMSSM, and I'm just very excited to welcome you to our webinar. We're about planning this for an hour, and we're going to kind of talk for about the first 45 minutes, and then we're going to open it up for a Q&A. So when you enter the webinar, if you could keep yourself on mute until that time, that would be really helpful. So maybe we can move to the first slide, Brian, and get us started. So just an overview of what our committee is all about. Our mission is to advocate for policy that supports three things. So the practice of sports medicine, so what we do as sports medicine physicians, whether it's in regard to practice management, billing and coding, things of that nature. But we also advocate for policy that supports athlete health and safety. So examples would be things like concussion legislation and policies at different levels of play that support health and safety for athletes. And then also physical activity promotion. So we know that's part of our mission as well as an organization, but that's on our list of things we advocate for at our committee. So here's a breakdown of the leaders. As I mentioned, I'm the chair. We have 4 subcommittees under the Practice and Policy Committee. The first is our Legislation Subcommittee, which is headed by Dixit, who is also the vice chair of our entire committee. And so Samir's internal medicine is a background, and he's board certified in sports medicine as well. He's at the Hospital for Special Surgery in New York. He's been on the committee for a long time, longer than I think everybody here, about 10 years, but he's been the vice chair for the last 2 years. So he has a lot of experience. He also does team coverage in New York for the Knicks and US lacrosse. And then Alex Diamond, who's also been on the committee for 2 or 3 years. He heads up the Community Advocacy Subcommittee. He's unable to join us tonight, so I'll be able to summarize what's been going on in that area for him. But his background is pediatrics, and he's in an academic setting at Monroe Carell Children's Hospital at Vanderbilt in Nashville. Covers multiple high schools, Vanderbilt University, the NHL team, Nashville Predators. And so he can't be here tonight because he's our AMSSM representative to the NFHS, and they have their annual meeting tonight. So he's representing AMSSM at that. Michael Swartzon leads our Practice and Economics Subcommittee. Michael's in Miami. He's in a mixed practice that's part academic, part private practice in orthopedics and sports medicine. His background's in family medicine. He covers 2 local universities, Miami Dolphins, which is probably what we're seeing in the background there in his office, the Miami Marathon and Miami Open Tennis. And he's been on the committee for about 6 years. Luis Rodriguez heads up our healthcare quality subcommittee. He's actually in the same practice as Michael. His background is internal medicine. He covers an MLS team in Miami, the Miami CF, US ski team, as well as Florida International University. And then Sonia Ruparell is our fellow liaison this year. And she's actually doing her fellowship at Lurie Children's, which is where I practice. And she brings a bit of an international flavor to our committee. She completed her pediatric residency at Cornell University in New York, but she grew up in Canada and she attended medical school in Ireland. So we're just really lucky to have her on our committee. And then last but certainly not least is Brian Williams, who is a relatively new addition to AMSSM. He joined in July of 2019 as the AMSSM Director of Policy and Advocacy, and has been hugely helpful. He's based down in Maryland, right near DC, and his experience includes work for the American Public Health Association, the American Heart Association. He spent 10 years in a health policy think tank, and before that he's worked for many years on Capitol Hill. So to have someone on the Hill sort of advocating for AMSSM and kind of sharing all the recent developments, everything that's going on has been really helpful for us as a group. So for this webinar, here's our plan, what we're going to go over. I'll kind of summarize what we've done in 2020, our plans for 2021. And then each of the subcommittee members will summarize what's been going on in their arenas, including opportunities for fellows, which Sonia will present. And then we're going to have about 15 minutes at the end for questions and answers. So feel free to start using the chat feature as we go along and enter your questions, and then we'll get to them at the very end. So the structure of our committee and what we do have monthly meetings for our subcommittee leaders every month. And we post a summary of all the things that we discuss on the AMSSM Collaborate in the Practice and Policy Committee section. So if you become a member of our committee, you'll be able to see all of this on the Collaborate website. So I highly encourage you to do that. We also get a feature in the AMSSM Weekly Digest. Every month there's an advocacy corner, which also summarizes what we've been up to. And then every year there's this National Conference of State Legislatures, and I'm gonna actually ask Brian to describe that a little bit. This past year when I took over as chair, it was canceled due to COVID. So I don't have a lot of experience with this, but I know that he does. So I'm going to kind of let him describe what that's all about and how AMSSM is involved.
Yeah, thanks, Cynthia. So the National Conference of State Legislators, just like the name kind of implies, it's a national organization that state legislators can join, and they convene at least once a year in a big meeting, and then they have other smaller meetings throughout the year. AMSSM has been a yearly participant. We purchase space on the in the event floor where we can interact one-on-one with state legislators. We've had many stories, too many to recount here. One just in particular, we had talked to a state legislator from South Dakota about the issue that we were having with traveling team physicians and being able to have licensure in South Dakota. And that particular state legislator was so, was taken by our conversation, went back to South Dakota, introduced the bill, got the bill passed, the governor signed it. And then the next year came back to our booth and reported to us. That was 2 or 3 years ago, but it's just a chance for AMSSM to work, to interact one-on-one with state legislators and explain our issues and kind of be there. Like Cynthia said, COVID has kind of put a kink in our plans. We're not sure what's going to happen this year, but we'll keep everybody informed.
Great, thanks, Brian. I'm also going to put a plug in for folks to attend the annual meeting. We have 2 opportunities to hear about what's going on with practice and policy. So our committee meeting is going to be Thursday, the 15th at Pacific time, either 5:15 or 6:20. And then for our in the general session, we have a whole session devoted to practice and policy. And so if you can advance to the next slide. This summarizes it. It's been posted on the website, so you can reference it there. But we have an hour and a half devoted to this, and we've decided to tackle on the topic of COVID actually, and riding the waves of change, how sports medicine has adjusted and adapted to what's been going on with COVID. And one nice opportunity is Brian will be able to present to the whole membership how to craft policy and advance sports medicine access and care for everybody, with a focus on equity and advocating for populations that are under-resourced. And then we have a panel discussion, which is going to be hopefully very informative. How have we returned to sports and at multiple levels, professional, collegiate, high school, and even mass sports events. So, and then finally, Michael Swartzon is going to kind of focus on telemedicine as part of how we've adapted in the setting of COVID, and some keys to making that a productive tool for your outpatient visits in sports medicine. All right, so as Brian mentioned, COVID sort of hit and kind of redirected a lot of our efforts, but despite that, there are a lot of things that our committee supported, advocated for, and accomplished. So I'm going to hand it off to Brian now, and he's going to summarize these key items.
Yeah, thanks, Cynthia. So this hopefully just gives you a flavor of some of the work that we've been doing. We've been tracking a lot at the state level, but these are just a few of the things that we did sort of at the federal and national level. One is the Empowering Olympic, Paralympic, and Amateur Athletes Act of 2020. We monitored that pretty closely. That was a bill that was focused on creating more congressional oversight over the Olympic Committee, and making sure that everything there in terms of athlete safety, especially putting into protocols to make sure that there's reporting mechanisms for abuse and so forth. Anyway, we followed all of that and made sure that our statement that was recently published was made known to the senators and to the House members, and everybody appreciated that. It was kind of a collaborative effort to make sure that that bill was passed. We also signed on to a letter encouraging the Department of Health and Human Services to publish physical activity guidelines every 10 years. That the HHS has already been doing that, but this would codify it into legislation and make it a requirement for HHS to do that. We also, during COVID, obviously, all the small businesses in the United States were severely hit, but a lot of those youth sports organizations were even hit worse because they don't really rely on payroll. So the payroll protection program didn't really reach to a lot of the youth sports organizations. So we worked with a coalition of members to work with Congress to make sure that the next iteration of the Paycheck Protection Program would reach to youth sports organizations, which it did. So we're happy about that. We're very proud that that was accomplished back in December. We also did a lot of work on the CMS Medicare physician payment rule. Michael Swartzon is going to go into this a little bit more later, so I won't go into this too much, but the final rule included some payment increases for evaluation and management services. We fended off, I think we were successful in fending off some cuts that would have severely impacted family physicians in particular, and sports medicine physicians more broadly. So I think all in all, we're very happy with the outcome of the physician fee schedule. And again, Michael will kind of talk about some of the details on that a little bit later. And then we worked with the Centers for Disease Control a little bit last year on a response. They're working on some pain management. They're just trying to gather information on pain management in different ways. That physicians have been, different techniques physicians have been using to manage pain. And we were pretty involved in putting together comments on some of the techniques that sports medicine physicians use to manage pain. We had a call out to essentially to the entire AMSSM membership to submit their comments. And I took all of those comments and compiled them into one document and sent them to Centers for Disease Control. It's part of an opioid abuse initiative that they have over there to reduce the use of opioids and try to find other ways to manage pain. And then one area that I'm glad we highlighted here that's a little bit out of our comfort level is over at the Immigration and Customs Enforcement Agency. There was a proposed regulation that would have clamped down on foreign national J1 visas, which there are a lot of physicians that come over to the United States on a J1 visa, and they pursue fellowships and so forth. And this would have, the regulation would have instituted an arbitrary deadline on when they would have to go back and renew that visa. In some cases, not allowing J1 physicians to finish their fellowship. And so AMSSM joined with a few other physician groups in protesting that regulation, and that's still kind of ongoing. So we're still watching that one. The one that I think that has been of interest over the last several years is this licensure exemption for traveling physicians. And this is just a report that we're down to 4 states. There's 4 states left. We're trying to get that bill passed. Hawaii, I just noticed earlier this week, has introduced a bill. So we're going to be working in Hawaii to make sure that that bill passes. And then you can see Kansas, Nebraska, and Oklahoma. Those are the other 3 states in addition to Hawaii that we're working on. So if any of you are from those states, I want to hear from you, because we want to just push that issue and get that done. That's really a legacy issue for AMSSM, and we want to make sure that that we finish it. COVID obviously impacted a lot of things, but it impacted this effort too. We didn't get much done last year because the state legislatures they'd left town, and when they did come back, they worked mostly on public health, COVID type issues. So I'm going to turn it back over to Cynthia, who's going to talk about 2021. Unmute.
Thank you. Thanks for that great summary, Brian. I just want to highlight that a lot of those things and those opportunities get posted on the AMSSM Collaborate site. So for instance, that CDC call for comments, we posted on that Collaborate site, and we were able to solicit some important comments that we were able to, from the members, AMSSM members, that we were able to include in the letter that we sent. So that's another great reason to stay connected with us through and look for messages on the Collaborate site. Okay, so planning for 2021, we sort of divide our priorities into 3 tiers and divide kind of the topics of different policy and legislation according to whether it falls into one of these 3 tiers as to how we sort of approach our role with that legislation. So tier 1 are these high priority issues where we really want AMSSM to be the one taking the lead role. So these are things related to the traveling team physician, like you just heard about, any legislation related to concussion, pre-participation physicals, emergency action plans, things related to athlete care on the sidelines, sudden cardiac arrest, AEDs, but also things like opioids and athlete patient treatment concerns, whether it's pain management or other sports medicine related issues, as well as player safety issues like equipment regulations and rule changes. And then tier 2 issues are those that are important, but where we want AMSSM to take an active role, but not necessarily be the lead role. So for instance, these might be issues affecting the athletic training profession where, they're important partners for us. And if it's something that supports athletic training and their profession, we would take an active role, but not necessarily the lead role. And then tier 3 are issues where we want AMSSM to take a supporting role. We know they're important. We might support legislation, but we're not as active. And these would be things like asthma, obesity, and physical activity. All right, so now I'm going to hand it off to Sam, who's going to talk about what's been going on in his subcommittee with legislative issues, and importantly, how you can advocate at your state level.
Thanks, Cynthia, and thanks to everyone for joining us this evening. Shout out to all our state legislative contacts. You really play a key role for us in terms of our advocacy. You're sort of our eyes and ears on the ground in your states, and really help us as we're a volunteer organization, and we really rely on you all to advocate for our colleagues and our organization at the state level. So in terms of resources we have, at the AMSSM homepage under advocacy, we have some resources that I think are very useful for those that are interested in or who are new to our group or who are just interested in learning more about advocacy. And this state legislative handbook is actually really an excellent resource. It has information about sort of the tier issues that Cynthia just outlined, and as they kind of get updated, the handbook gets updated. Our key contacts are listed in there, issue briefs, which we'll get to in a couple of slides, and then also some basics for government and advocacy basics. I know for me, for me personally, that was very educational when I first saw it. I think most of my knowledge on this has kind of come through, media channels and things like that, and sort of 11th grade U.S. history class. So I think it's good to kind of review that for those of us who want to get involved. And there's just a ton of resources on that page, if any. And I think Andy just put it in the chat, and I think it's behind the membership wall. I think Brian has the next slide.
Yeah, thanks, Sam. So in addition to that, we just highlighting some of the resources that we have at the webpage. The map is an interesting resource. So we subscribe to a service that using a few keywords, I put in the slide there, keywords like concussion or player safety, this subscription service will go out and search all the databases from all the states and find legislation that deals with concussion or patient safety or whatever the keyword is. And then we review those as a committee, and I look at those. And if it's something that we are interested in, we put it on the map. In other words, online, you can click on your state and you can see which bills are your state legislatures working on that we are either monitoring, or maybe we support that bill, or sometimes we oppose the bill. If you know of a bill that they're working on in your state that is not on the map, just reach out to me or Sam or Cynthia or anybody on the committee, and we can get it on the map. Sometimes the keywords don't always play out. Some states use different terms, for different things. But the idea being, we want to track this, and then as hearings come up, as the legislatures vote on those bills, we just want to be aware of those so that we can weigh in one way or the other.
I think the other thing that we have on that under the resources are issue briefs, and there's a list of some of the briefs that we have currently, and I think this is really useful. It kind of they're one pagers on sort of what we focus on as an organization in terms of advocacy for these issues, and I think we, like the rest of the world, have been focused on COVID over the last year, so we haven't focused on these as much. But as we move forward, these are very useful tools. If these, for example, if a concussion bill comes up in your state, it's a good thing to look at.
These are just similar to the issue briefs, which, by the way, you can print out those issue briefs and hand them out to legislators or to others that are interested in that issue. Likewise, these brochures are very helpful, including this one that's blue that's kind of highlighted here, specific to legislators and staff. Not all legislators understand. You think of a legislator, they ran for office, usually on one or two issues. They were worried about high water bills, or they were worried about traffic or something like that. So they may understand water policy and traffic policy, but now they're being asked to look at healthcare policy, and they may or may not even understand what healthcare is or what sports medicine physicians do. And so these brochures give legislators and staff a very basic understanding of what a sports medicine physician is. And then as you get to know them, and as we all kind of develop relationships with legislators, this is the foundation. Now they kind of get what you do, and they understand where you're coming from, and then we can talk to them about whatever the specific policy is, whether it be concussion or player safety or whatever it is. But these brochures are all on our website, available to be printed off. If you need help with that, just get in touch with me, and we'll help you with that.
Then some best practices that we kind of outlined for our sports medicine physician advocates, and I really thank Brian for kind of putting this together. Regularly check your state legislation tracking map for your state. That's easy enough to do if you go to the AMSSM website. Sign up for state medical and specialty society advocacy activities. So I know that when I was in Maryland, MedChi is the Maryland society there, and they're very, very highly active from an advocacy perspective. And similarly, ACP, which I'm a member of, is very active, and they will share their information freely with their membership. Participate, be an active member of your community, which we all are. Tap into the state associations, school and athlete associations. Reach out to our non-physician colleagues, athletic trainers, physical therapists, administrators, parents, and then find out who is on your state medical board and monitor their agendas. That's something that often changes over, and it's good to know who they are and also what their knowledge and familiarity with sports medicine is.
Yeah, and just a few more tips. Like Sam was saying, we're looking to build these networks, right? So the way that you do that is pretty easy. There are other AMSSM members in your state. So we already have a built-in network just of AMSSM members. But if you belong to other professional organizations, just like Sam mentioned, ACP or whatever your professional organization in your state medical society and so forth, that's a good way to build networks. Find other people in that network. You can send emails and you organize, and that's just how you share information with each other about what's going on and what you can do to help. We have a lot of information on the AMSSM advocacy website. We're still working on building out more issue briefs and trying to put more information on there. Cynthia mentioned the Collaborate website. We're constantly growing in all of those areas, and so keep checking back and finding more information there. All right, the next couple are well, this one on organizing advocacy days. If you're interested in organizing an advocacy day, reach out to me and I'll help you with that. There is some information about that in that state legislative handbook that Sam mentioned, and we can get one going for you. And sometimes those can be just 2 or 3 sports medicine physicians that go up to your state capital on the same day and do a kind of a blitz of meetings, maybe 3 or 4 meetings each. Or it can be more complex, but it doesn't have to be complicated, and it doesn't have to be expensive. It can actually be relatively simple. So I'll quit talking about that. You just reach out to me if you have any interest in organizing an advocacy day. And then last but not least is be sure to attend our Practice and Policy Committee meeting. It says in Atlanta. That's actually a typo. We're gonna be in San Diego this year. Hopefully we'll have some announcements on that soon, but be sure to attend the Practice and Policy Committee coming up at our annual meeting in San Diego. If you're in Atlanta, you'll be in the wrong place.
And then just some final tips. Lawmakers generally have shallow knowledge about a lot of topics. You are a subject matter expert. Don't be shy. You're educating policymakers who want to succeed. They want to get it right. If there's something you don't know, just say you'll find out and get back to them. Use those AMSSM resources and evidence-based or documented sources. If you need help focusing, definitely look at the tier issues that we're focusing on to help guide what we're focused on as an organization. Always provide your contact information, follow up and with what you promised to do. And then ask us for help. Those of us on the committee and the organization have a lot of experience. And I think it really does come down to experience. The more you get to see these things, the more familiar you get with how to navigate them. And I think Brian's been an excellent resource for us in helping us through a lot of these things. And next, I will turn it over to the community advocacy folks.
Okay, thanks, Sam. I'm going to present for Alex on the community advocacy subcommittee. So it's a lot of action going on in this area. We actually just, and this kind of lists the things that we've been working on in this area. The Presidential Task Force on Sexual Violence in Sport, the Youth Sport Advocacy Team has some updates. There's been a lot going on with COVID-19, as you probably are aware. I already mentioned the Advocacy Corner in the weekly AMSSM Digest. And there's an annual award that AMSSM gives out for advocacy that I want to mention here that should be, there should be an announcement coming in February with details. So look for that in some of the email updates. So this is just, I want to highlight this month's issue of BJSM. The position statement that was, the lead author was Jennifer Koontz, who's the prior chair for this committee. She did an amazing job with this statement along with all these other authors contributed, and it just got released in this month's issue. But importantly, it's already been endorsed by USA Gymnastics, and they already have a plan for their medical staff to undergo enhanced education based on the points that this AMSSM position statement highlights. So that's a win for us. And I know that the task force is working on getting similar arrangements and collaborative with other groups. Next slide. So this is what the Youth Sports Advisory Team has been working on, and Brian mentioned the Advocacy Day. We actually, the Youth Sport Advocacy Team had an Advocacy Day back in January, right before COVID hit. It was one of the last things we were able to do, I think, in person. And we were able to arrange meetings with a few lawmakers, but also the Surgeon General and some members from HHS. And we really communicated and our advocacy for youth sports, and we were developing this toolkit while we were there, and sort of the content of that, which really dovetailed nicely with the National Youth Sports Strategy that the HHS was working on and getting that pushed out. So we finalized the material for this toolkit, and I think the next slide will show you. So it's still in the building phase, but in the next few weeks it should be released and should be live. And it's going to be an interactive website where parents and coaches, athletes can click on some of these common questions. For instance, on the right here, it says, how can parents advocate for safe and healthy sports for their child? And if you click on that, this other screen pops up that gives tips and other links. So we're really excited about that. Look for that. We'll probably put that in one of our announcements through the weekly emails for AMSSM. And then with respect to COVID-19, we formed a collaborative with AAP leaders and leaders from NATA. We called it the Return to Youth Sports and Recreation Collaborative. And there was a group of us that worked on several issues, but mainly educating parents about how to be informed when returning your child back to sports. We put together 3 infographics, which are on the next slide, but on this slide highlights the webinar that we did. It was a series of 3 webinars actually back in August, and it was extremely well received. It had a bunch of experts talking about different pros and cons of and risks involved in benefits of returning kids to sports. There was a Q&A session. And so our plan is to continue this series and potentially do another set of webinars focused on mental health and the impact that COVID-19 has had on youth athletes and how parents can navigate that landscape. And the next slide shows that the 3 infographics that the team put together. One was, again, related to the evaluating the risk based on the type of sport and whether travel's involved and the type of mitigations that might be in place. There was a whole infographic on wearing masks, as well as a safety checklist. If your child is going back to sports, here are the things to make sure you're doing to keep them safe. We're working right now on a mental health piece as part of this, and an infographic is forthcoming on that. And as I said, a webinar will follow too. And I'm going to hand it off to Michael now for the practice and economic issues update.
Well, hello. Thank you everyone for joining tonight. I am Michael Swartzon, as the slide says. I have my email up here just in case you have any questions, but there's multiple different ways to get a hold of us to help answer any further questions. So if you didn't know, as of January 1st, we all got a raise. So congratulations. I wish I could send everyone champagne, but just virtually congratulate yourselves. Finally, the legislatures and Centers for Medicare and Medicaid decided that your thought and your prevention care deserves a little bit more. In addition to actually getting a raise, they've tried to simplify our lives by reducing unnecessary documentation. Whether that's actually going to happen or not is still up for debate. This just started this month, but certainly it was a very good attempt at revising the rules that we've been working under since 95 and 97. So just as a quick summary, right now, evaluation and management codes that are used for ambulatory outpatient office visits are now selected either based on total time or by medical decision making. So before, you had history requirements that were tied to review systems and past medical, family, social history. And there were also physical exam requirements where 97 guidelines required these very extensive bullet points and 4 different body parts at the same time, which had to be medically necessary. So we were really restricted in what we could do. Those have been relabeled as please do what is appropriate. And there's no minimum standard required other than what you decide. So now the time to code those visits, it's higher than it was before, but it does not have to be the face-to-face time or the counseling and coordinating care that's greater than 50% of the visit. This covers your entire time dealing with that patient on that day. And if that can include looking at their records, making phone calls to other doctors, calling for transferring them into the hospital, trouble with the EMR on their chart, all of that time counts as long as you're the one doing it. The consultation codes are the same. Next slide. So here are the exact time requirements. This is something that is available pretty easily. I'm sure these slides will be available where you could Google them. Next slide. So medical decision-making has had a bit of a difference. There's still the three categories, which is the A, the problem assessed, B, data, and C, the risk of the management involved. And you still need 2 out of those 3 sections to come up with the total complexity for the visit, which equates to the E&M code. Some of the things that were a little bit confusing when they had mild before, now issues are either acute or they're chronic. And so those are very descriptive words that the minute you see the patient, you can understand, okay, this is an acute problem that's complicated. This is an acute problem that's uncomplicated. This is a chronic problem. This is chronic with severe, you know, so they made it a little bit easier for you to categorize them as far as the problems being addressed. The data was also further clarified, as in, you know, if you have an independent historian, a caregiver, a family member that has to give the history because they have dementia, then there's certain points that add up, and that's clearly, you should see, actually, we can go to the next slide. So I don't know how well you can see this on your screen. This is straight from the AMA, and if you don't know, the AMA is a very strong partnership with CMS to help with all these coding things. There's a lot of committees, and so that whole CPT book is really put out by the AMA. And so you can see on the left side, you'll see the code. Right next to it, the next column is the level of decision making. And then these 3 columns afterwards are the A, problems, B, data, and then C, the risk of management. And so really I would encourage you, for each patient you see now, to go through this as an exercise each time. And I think in some ways you'll find that you'll be coding visits higher than you would have before, and sometimes maybe lower. And that's going to kind of balance out in a way. But I think overall, reducing the burden of putting in some of those meaningful use requirements, and in addition, allowing us to really focus more on data and problems rather than documentation, allows us to have more simple, efficient clinic lives, and hopefully be able to code at the appropriate level for the work that we're doing. You can go to the next slide. And so here, those of you who are on an RVU model, this is something that will clearly translate into your paycheck. Those of you who make money the old-fashioned way by billing for it and collecting, not everyone uses RVUs. RVU is really a Medicare, Medicaid number, but you can see, using Medicare as a baseline, what the increase in reimbursement is. And you can see for a lower level follow-up or a lower level established patient, a 99212 went up 45, almost 46%, and the 99213 went up 34%. And so even though maybe some of your follow-ups may not be 4s and now they're 3s, a 3 is worth a lot more than it was before. And some of those patients that you saw, which had to be an 03 because you didn't meet the physical exam requirements, now they can be an 04. And now you went from a 1.42 to a 2.6, which really, I think, hopefully will allow some of us that work under this model to spend more time with our patients to try and cover the complexity of their problem in its entirety, to work not only on their problem now, but on prevention in the future. So there's a lot of resources for this. We are working on things that are specific for the sports medicine physicians in our society. The AMA has that slide that I showed you before, along with some videos. The Centers for Medicare and Medicaid, CMS, also has many resources, family medicine, pediatrics, PM&R. Most of your home board bodies will have their own take on this. Eventually, we're going to learn what's working and what's not. There may be changes down the road. Certainly, they've delayed some of the other codes that they were working on. So for right now, basically, you need to look at how you're calculating medical decision making, and then make sure that you are reaping the rewards of the increase that's been very long overdue. Again, this is just the beginning of this process. I will pass it on to my partner, Dr. Luis Rodriguez.
Thank you, Michael. Thanks, everyone, for being here tonight. And thank you, Cynthia, for the kind introduction at the beginning of the webinar. Part of the work of my committee, the Healthcare Transformation and Quality Initiatives, has been working with Centers for Medicare Services in the MACRA MIPS subcommittees. There we've been able to advocate for measures to be taken into consideration as part of the quality incentives for Medicare payees that are meaningful to our membership, to AMSSM members. Unfortunately, as you can imagine, change at the Centers for Medicare Services does not happen rapidly, as Michael very well described. But we continue to, of course, look for those opportunities, and of course, opportunities to collaborate with other organizations like AFP and ACP to develop not only quality measures, but also perhaps training modules that can be counted towards our MOC points, maintenance of certification points, that are also more meaningful to our membership. And our latest work has been focused a lot on the Choosing Wisely campaign. We created a list some years ago now, and are working on a new list. As you can see here, Choosing Wisely is essentially a platform to promote conversations between clinicians and patients, and helping those clinicians and those patients choose care that is supported by evidence, truly necessary, free from harm, and in the end, in a nutshell, we're trying to improve the medical economics, make care more cost-effective and meaningful. If you can please go to the next slide. Perfect. So in June of last year, we sent out a communication to create a task force to work on these new recommendations. Brian did a very good job putting that e-blast together. And we got definitely a nice group of volunteers, and we've been working for the past few months in looking at evidence-based medicine for certain recommendations that we can add to our Choosing Wisely list. Next slide, please. And some of these recommendations that you will see are ultimately, our plan is to present these recommendations to our committee, to the Practice and Policy Committee. We've had a lot on our plate recently, so I haven't shared that with the rest of the group yet. But today after the webinar or tomorrow I will do so. Now that we have completed this, but just so you know what to expect, we also hope that we're going to share this with the membership at large, and provide a period of open comments. We want as many people as possible from the organization involved in finalizing these recommendations, and of course it will have to be ultimately approved by the board. But some of what you may see there are recommendations regarding the Ottawa ankle rules and when it's appropriate to obtain x-rays for ankle injuries, recommendations regarding physical activity and exercise prescription, the use of diagnostic ultrasound as opposed to, or in some cases as an adjunct to MRI for rotator cuff tears, for metatarsal fractures, and for the diagnosis, for the initial diagnosis of pediatric fractures. And we're also working on a recommendation regarding the management of pediatric buccal fractures. I can give you more details on that. When I train, we used to cast every single one of these buccal fractures, have them come back and repeat x-rays serially until we saw healing. And it kind of makes sense to make this recommendation as we're working on it. At least in my experience, I didn't see a single one of these get complicated or turn into a displaced fracture, right? There's good evidence out there suggesting that we can manage most of these, especially when they're at the level of the wrist with a wrist splint, and then having the parent monitor the symptoms. And once the area is non-tender and once 3 weeks have gone by, just remove the splint and let the kid go back to activity as tolerated. I'm of course, oversimplifying the recommendation. I'm hoping you'll all get to read it. This has been the focus of the committee as of recent, and we are hoping to roll out this new list of recommendations to Choosing Wisely soon, and continue to participate in what we think is a great initiative. And that's all I have.
Thanks. You can go to the next slide, Brian. So my name's Sonia. I'm the fellow liaison for this committee. And you can go to the next slide, Brian. Thanks. So our main goal this year was really to increase sports-related policy exposure for trainees, meaning medical students, residents, fellows, and engage in local policy efforts with AMSSM. So really take our advocacy learning curriculums and apply them to the real world. So thankfully, Brian's on this committee and had a really nice idea to connect trainees and members of Congress together. So that's what we plan to do this year. Brian typically meets with new members of Congress around this time. And this year, with everything going on, plans to meet them in around February of 2021. Typically, they're in-person meetings, and he will educate the members of Congress about the role of sports medicine physicians, our ongoing projects like that have been demonstrated in this webinar, positions on things like concussion, promotion of physical activity, and others. And so this year, all meetings will be virtual, again, 15 to 20 minutes. And our plan is really to incorporate medical trainees, so fellows, residents, and students into these meetings. So to give you an example, I'm from Chicago, so I would meet the designated member of Congress on a virtual Zoom meeting. And I, as a constituent and an AMSSM member and trainee, would be able to then talk about the topics discussed today, AMSSM position statements. And our plan is to kind of give a pro tip sheet. Sam went through some of the resources that are available, and we'll provide additional so you're well prepared for the meeting. But the goal is to really kind of get, again, this hands-on exposure to policy and start talking to members of Congress. So if you're interested in this opportunity, just look out for an e-blast and some emails that will be coming through as we plan this moving forward. You can go to the next slide. This is Dr. LaBella, who's getting our COVID-19 vaccine. So this is our most recent initiative and something we're quite happy to be a part of. Our goal was really to promote vaccination within our communities, for athletes, for our patients, and really to fight against misinformation regarding the vaccines, to fight against COVID-19. And so we partnered with this hashtag, This Is Our Shot Team campaign, which was a group of healthcare advocates from California that are promoting vaccination on social media. So they worked with the California Medical Board and the public health authorities there and have spread this nationwide and remarkably gotten over 59 million posts on social media in a really short amount of time. And so really we're asking members to contribute. It's really simple. Use the This Is Our Shot hashtag in your social media channels, whether that's Instagram, Facebook, Twitter, Snapchat, whether it's a picture of yourself like Dr. LaBella here getting the vaccine, your vaccine card, or just a simple post. Please use this hashtag, and then don't forget to tag at AMSSM so we can retweet your posts or reshare them as well. And I'll pass it back to, I have one more slide here. So the last thing I just wanted to say is we're constantly looking for fellows and trainees and to get involved. So if you have any ideas, comments, concerns, please feel free to reach out to me directly or anyone on this committee, because we're always looking for ways to grow. And I'll pass it back to Brian and Dr. LaBella.
Great, thank you, Sonia. I just want to say I think it's going to be even easier because of COVID, because all these things are going to be virtual, as you mentioned. So I think it'll be a lot easier for AMSSM members and fellows especially to join some of those meetings that Brian's arranging. So we can open it up for questions and feel free to type them in the chat function. I know that Andy has already put in the chat function several links. And so hopefully these will be saved somewhere, or maybe people can get a printout of the chat. If that's true, Andy, because I think that these will be helpful. But we're happy to take questions here. If you don't have time and you have to run, as we said, you can email us directly, or you can go through the Collaborate site so that that your question gets posted to the general audience, and so will the answers, and so can share the knowledge with the whole group. But I just want to thank all of our presenters today. I realize now how much work this committee has been involved in. So, so thanks to the subcommittee leaders. It's really been great working together with such a dynamic leadership. All right, here we've got some questions. Okay, here's a question from Marcus. In addition to participation in the virtual meetings with new legislators, any suggestions for ways for current residents to get their feet wet with AMSSM related advocacy? So I think that those virtual meetings are a great idea. I think, again, becoming a member and logging onto the Collaborate site and just being familiar with the different policy and legislative initiatives that we are either leading or supporting is a good first step. There are opportunities to get involved and advocate, not only at the state level, but if you have a particular interest in one of the subcommittees, you can reach out to one of those leaders. And I think Sonia too, as she said, she's a good liaison for any trainee.
Remember that most legislators don't know residents, fellows, physicians. They think we're all doctors for the most part. So don't think that because you're still in training that your legislature won't listen to you. Normally, we go after something when an issue comes that we're either really for or really against. But considering your interest, Marcus, I would suggest that you look at your home address and find who are your state and national legislatures and just try and reach out to them or their staff when you have a chance. When there's nothing on the table, it's a lot easier to just reach out, say, hi, I'm here, happy to help if you need me. And if they have an office nearby, stopping by can help. And then for anything more specific, Brian can certainly help you.
Yeah, I agree. Marcus, you can reach out to me and I can help you find some of that information, and it will be, some of it's reactive. If a bill comes up and we could use your help in whatever state you're in, maybe we can reach out to you and ask you to contact your state legislator in behalf of AMSSM, for or against a piece of legislation. But just like Michael said, it doesn't have to be reactive. You can be proactive, just kind of building relationships, right? All those relationships is just getting to know them, and they will be interested to know you, frankly, because you are a potential voter, right? That's why they exist. They're in office because voters put them there. So if you can identify yourself as a voter, that's really easy on your part, and it will be easy for them to start building that relationship.
I think too that Sam mentioned the legislative handbook is a wealth of information about what AMSSM supports and does, and what they are not just currently involved in, but have been. So I think that's a good way to kind of do some background reading first before you start meeting with lawmakers.
Yeah, just to piggyback on that, I think to get your feet wet, I mean, it's a very quick read. It's very well done, and I think you can sort of see where the organization stands and then sort of apply it to where you are locally. And Brian's great at helping folks make those adjustments. There also tends to be a lot of hurry up and wait. So that reactive part that Brian's talking about, you know, there'll be a lull and then all of a sudden there'll be a flurry of activity. It's just the way it normally goes.
Yeah, thank you all. Really appreciate that.
And it's important because it's one of the things that we were talking about during our previous meetings within the committee. You know, the more people we can get involved with advocacy, the easier it's going to be for us to get some traction as an organization. So thanks for your interest, Marcus. Really appreciate it.
And Nicole just sent a note that she can help with license advocacy in Kansas, so the Licensure Act. So that's great, Nicole. Thank you.
Thank you, Nicole. We'll be working on that one. And Jennifer Koontz, Dr. Koontz, who is in Newton, am I saying that right? Newton, Kansas. She's working on that as well. So we really need to get the pressure going in Kansas and get that across the finish line.
Mm-hmm.
Yeah, I'm from the Kansas City area where Marcus is. So we have this Family Doctor of the Day where you sign up and you go. I think I'm going March 11th. I don't know if that's a good day, but yeah.
They're still having that for you guys, even with COVID?
You know, COVID doesn't exist here in Kansas.
Nicole, this is Jim Griffith. It would be probably value. If you don't know Jennifer Koontz, it would be valuable to visit with her. She's worked in the past with the Kansas State Medical Society as well as the State High School Activities Association and trying to get this passed in the state of Kansas. So it would, knowing that you're going to have that Doc on the Day event, it might be nice if you were able to touch base with Jenny.
Yep, we've met in the past. So yeah, I'll reach out to her.
Oh, you're muted, Dr. LaBella.
Thank you. Fellows are so important. I don't see any more questions, and we're about out of time, but I want to thank everyone for joining. Hopefully you found this informative, and please let colleagues know that weren't able to make it. This is recorded, so they'll be able to watch it and learn from it, as well as all those links will be shared as part of this too. I hope you all join us for the annual meeting at the committee meeting. As I mentioned, we don't know if we're going to be hybrid or virtual. We'll probably get that announcement in the beginning of February. And yeah, we look forward to seeing you at the practice and policy session as well. So again, feel free to reach out directly to us, and take care.